Good afternoon and welcome to Health Science class. My name is Mr. Justice and this is for the afternoon class. We are in the DHO book, unit number 3, Personal Qualities of a Healthcare Worker. Now let me see if I can adjust this just a little bit. There we go. Maybe a little straighter, a little turn maybe, something like that. There we go. So I'm going to start on page 60 and we're going to do a short video, short lecture on personal qualities of a healthcare worker. So, wrong one. I wonder what that is. Oh, maybe lunch, powdered donuts, not. So, personal qualities of a healthcare worker. So what I want you to do, we're going to start on page 60. By this time, I put up the assignment, which was do the review questions at the end of the chapter. And you'll find that on page 72. There are 10 review questions. I'm not going to read those to you. But those are the questions that you will turn in on your next assignment. So as we talk about personal qualities of a healthcare worker, we want to be in good health. I'm not going to read to you word for word again out of the chapter. I want you to read this. I'm just going to hit some highlights, explain to you things that when I was a director of nursing, when I was in a supervisory position, that I looked for and that were very important to the team dynamic. Some of this we didn't put as much emphasis on as others, but it helps us create as a whole good qualities for a healthcare worker. So diet, having a good diet is good for optimal health. Rest, getting adequate rest, so that way when we come into our job to help those people who are sick or injured, who are in a situation where they need help. So we need adequate rest to be able to do that. Exercise helps maintain circulation and our physical abilities to work and to move. And it gives us a better attitude. It gives us, we exercise, it releases endorphins, we feel better, we create more energy, which is awesome. Good posture, you noticed I just adjusted, setting up straight, keeping your body in good alignment. That's one of the things we do as nurses when we're working with patients. We want to keep their body in good alignment. It just helps with the overall process. Avoid the use of tobacco, alcohol, and drugs. So we certainly don't want to be at work inebriated. We don't want to be under the influence of any substance that's going to impair our ability to care for others. Tobacco comes with its own set of problems, lung cancer being number one, chronic obstructive pulmonary disease, emphysema. You get more colds and flus and those kind of things when the respiratory doesn't work really well because you're putting all that junk in there. If you do smoke, also making sure that doesn't linger on you or be around someone to get secondhand smoke or third-hand smoke. Those are things to think about. Of course, alcohol and drugs, those speak for themselves. You don't want to be doing all kinds of drugs and then trying to go into work or even driving. That's not safe for you. That's not safe for the people around you. So you don't want to be under the influence of alcohol or drugs. Now, I do know I'm not a teetotaler totally, but we talk about wine, an ounce of wine, red wine at night, they say is good for the heart. So there are good uses for alcohol. And I know some of you are thinking, Mr. Justice, I can't believe you said that. There's good uses for alcohol. Hey, it's a good sterilizer. You know, think about COVID right now. It's the only time in our lifetime that we've been able to wear a mask and smell like moonshine and be pulled over by the police and nothing happened. I know that's kind of a joke, but it's kind of true because, you know, the officer says, have you been drinking? I smell alcohol. Of course you do. It's this hand sanitizer that I just put on for the 1400th time today. My whole body seems to smell like moonshine. It's a strong smell of alcohol. Just a little funny there, but no, we do not want to be under the influence of alcohol or drugs. Uniform, we want to make sure our uniform is in good shape, that we present a good positive appearance. The clothing, if it's worn or torn, we want to replace that. Name badge, that way they know who we are. My name badge here, Mr. Justice, Millard Area Technology Center, Pike County, Kentucky. When I go somewhere, generally I'll put that on. I'll wear that to clinical. I know clinical seems like a thing of the past, but we'll eventually get back to clinical. I not know how many years. Look at my English. Perfect, didn't it? I don't know how long it's going to be until we can get back to clinical, but that's something that we look forward to. But we want to be able to identify ourselves on our job. facilities and jobs issue name badges, so that way you can be recognized. Shoes, we want our shoes to be in good repair. I tell everybody, you want to take care of your feet and legs. You're on, and your back. Those are the three things you really need to do. Good supportive shoes. You want to wear a hose, TED hose, or some type of support hose to help with your legs and circulation. And of course, you want to lift appropriately and properly using good body mechanics to protect your back. Personal hygiene, take a bath. Wash your hair. Wash your hair. Underarm deodorant, brush your teeth. Be conscious of how you present yourself and what you look like and what you smell like. The old-fashioned saying is you can't make a silk purse out of a sow's ear. Well, that still holds true today. You can't, but now we can be clean and we can smell good. All right, better a good smell than a bad. Nails, we want them nursing. We want them trimmed. We do not want to cause any injury to our patients, so we want them trimmed and shaped in a manner that we have decreased the potential of injury with our nails. Hair, not any elaborate hairstyles, but it needs to be up off the collar. We don't want it dangling down when we're giving care. Jewelry, I tell nursing students, if you wear a necklace, it needs to be underneath. You don't want anything dangling. If you wear earrings, they've got to be post. I recommend if you wear nose rings or a lip ring, then that needs to be a nude color or a neutral color. A lot of times when you deal with people who have dementia, if they get scared, they'll reach up and they'll grab. If you've got anything dangling, you could lose an ear, an earlobe. If you see something metal on your nose or something shiny, they may reach for it. We don't want to see a lip ring pulled out or a nose ring pulled out. So if you have those things, when we go to clinical, they need to be post and nude, the neutral colors, skin color, and that's a safety issue for the worker. Now, if you personally, I have nothing against any of that. That's up to you if you want to wear that. But in a nursing setting, then that's not appropriate, safety-wise. Makeup, we don't want excessive makeup. So those are some things that, if we're talking about the physical and professional appearance. Empathy means being able to identify with and understand another person's feelings, their situation. We need to have empathy toward those that we are dealing with. Honesty, dependability, willingness to learn, patience, acceptance of criticism. That's a hard thing to do sometimes because we think, well, we're doing it right, or we think we know the best way to do it. Sometimes that might not be right for the current situation, so you'll want to listen and as you're taught, and it can help with your performance on the job. Enthusiasm, self-motivation, tact, competence, responsibility, discretion, being a team player, able to work together. Now, I will warn you, even on this video, I will warn you there'll be those that will appear to be team players, and then they'll say, help me do mine, and then I'll help you do yours, and you do theirs, and then all of a sudden they're on break and gone, and then you're still doing yours all by yourself. We want to be a team player. We want to work together, but we want that load distributed equally for the most part, and we want to help. We don't want to be an isolationist. We all need help, and we want to be a team player. It takes teamwork to take care of people. Page 66, 67, information about professional leadership. There's legal responsibilities and roles. There's different types of leaders, as you'll find on page 67. I want you to read about that. See if you can identify what type of leader you would be based on the three that are given there in 67. Now, we need to take care of ourselves. Stress is defined by the body's reaction to any stimulus requires a person to adjust to the changing environment. There's good stress and bad stress. If I'm getting ready to go on vacation, which sadly we're not right now, but not supposed to be going out of the state, not going anywhere on vacation, kind of isolating ourselves. The cases of COVID are rampant. Our numbers are going up. Our hospitals are getting taxed. It's kind of sad, the situation that we're in. Just get on my soapbox here for a moment. I hear everybody say, wear a mask, and masks aren't helping is what they'll say. And I can tell you why masks aren't helping. When I go out, I wear my mask appropriately. Let me example, just a regular facial covering. Here we go. I've got my mask. I get it on. If I get it down and I don't fog up, I'll even wear it in the car. Oh, you're saying, Mr. Justice, you're looking better all the time. Woo! You got that face covered. But let me say that this is appropriate. Now, there's different types of masks. This is just a regular surgical mask. There's an N95 mask. It's generally a white mask, provides a little bit better protection. Now, if everybody wore their mask this way at all times, you're going to see the decrease of the spread of germs. Of course, there's all kinds of people who come up with all kinds of things, and I'm not there to argue about that. I just want to make a point. All right. Now, I went to doctor's appointments with my wife yesterday and with my nephew. I was in a number of places related to this, and people are wearing masks, but they're not wearing masks appropriately. They're wearing masks like this. There's no protection there. You know, it's maybe, you know, you think I don't know what you're thinking. This is not appropriate. Got my mask on. Does not stop the spread of disease or infection. You sneeze, somebody sneezes, I walk through it, I'm going to breathe that in. There's no decrease in the viral load. There's nothing there to stop it from going right in. Same thing with this. Or if they're wearing it like this, I got my mask. None of that will help you. So when you wear a mask and you go in for my class, make sure that you have the mask on, that you do your best to create a good seal at the nose, and you go somewhere. There we go. And that's where you want to keep it for the duration. You know, and you want to decrease the amount of times you touch your face. And if you do touch, you want to hand sanitize and also wash. Don't be afraid to use hand sanitizer. Friction, time, rub it in, and then let it dry. Just fairly quickly. And when you breathe something in or somebody sneezes, you walk through it, this part of the mask is contaminated. So if I grab here, then I'm contaminating my hands. So what do I want to do with this mask? Well, I want to go behind the ears, and I just want to pull the mask off. Okay, and I want to keep my hands away from my face, around my... Now, glasses afford me a little bit better protection, and the fact that if somebody sneezes or coughs and I walk into it, it provides, but see, I still have openings. You'll see people who will wear goggles, and in COVID units, they'll have goggles on, they'll have face shields, they'll have respirators, they'll take all the precautions, gowns, gloves, shoe covers, all the precautions to prevent the spread of COVID. So, just wanted to throw that out there. Yeah, people are wearing masks, but they're not wearing them appropriately, and so thus they're not effective. That's the reason we're seeing a high incidence. And we still have people not wearing masks at all, for whatever reason they want to cite. That's up to them. I want to wear a mask. I want to protect myself. I wore a mask prior to COVID, and in fact, when I was a nurse and we would have certain isolation procedures, we would wear a mask. And it decreased the spread of infection. So, stress. So, stress is the body's reaction, and I got on that in the fact that I said about vacations. There's good stress, bad stress, but it's still stress. So, what are we doing to decrease stress? I recommend getting a hobby. I recommend trying to do something that's fun, something with physical activity in it, or maybe sitting and reading, maybe music, maybe taking a walk. Decrease your stress level. That increases your immunity, which is really good. So as we get to page 68 and 69, we want to look at that as far as things that stress. Again, not all stress is harmful. Some is you're really excited. It might be a little stressful, but you're excited. Say you're getting married or, again, vacation. And then we want to work on our time management skills. And we want to set goals with that time management. And that will help us be better workers. These are good qualities of a healthcare worker. Now, there's a lot of other things here in this chapter that you can read. So I want you to read this chapter, and then again, I want you to complete the review questions 1 through 10, and qualities of a healthcare worker, personal qualities of a healthcare worker. Think about what you would want if you had someone taking care of your family member, you had someone coming in your home and working, or you were a business owner. what type of qualities would you want in a worker? And I'm sure we want the best. Why are we there? We're there to help people, and we want to see them. We want to see them get better. We want to have good rapport with them and to support people who are there to help them, our patients, our clients, our residents, and that's just part of the process. So personal qualities of healthcare work. So this is just a short video, 15 minutes. The mind can only comprehend what the seat can endure. As again, I'll upload this. You can turn in your information. The next chapter that we're going to do is legal and ethical responsibilities. And this is in healthcare. What is your legal and ethical responsibilities? So if you are finished with the information after listening to this video, proceed to chapter 4, legal and ethical responsibilities, and we'll talk about that soon at a later time. Hey guys, thanks. This is Principles of Health Science, Millard Area Technology Center, the afternoon class. Have a good day. Be careful. Stay safe. Till the next time. See you.